Some VCU medical students say they're frustrated that staff who work from home have gotten the COVID-19 vaccine before them. Problem solver Melissa Hippolyte has been looking into how the VCU health system prioritizes who gets the shot and when.
On the first day of 2021, the VCU health system told its medical students they would be pulled out of their clinical duties for 60 to 90 days and not prioritized to receive the COVID-19 vaccine.
I can't imagine trusting like a Zoom-trained physician.
This medical student, who asked to remain anonymous due to fear of retribution from the school, says a large number of medical students are upset with the decision. They argue the CDC recommends healthcare students and trainees get vaccine priority. And they question why 15% of the VCU health system employees who have received the vaccine to date do not come face-to-face with patients.
From my perspective, it feels like we're not valued in the same way that employees are.
The student shared a letter penned by a group of VCU medical students to the CEO of the VCU health system, Dr. Arthur Kellerman.
He explained it that because of the health system, there are people that are deemed essential, like IT or payroll, who are needed to make sure that the system runs.
These snapshots from an email sent to all VCU health system employees show that on December 29th, the system opened up vaccinations to employees in Tier 9, which includes employees who telework.
To me, it seems like VCU may not be handling such a precious resource in a way the public deserves.
A spokesperson for VCU Health told us they are aware of the students' concerns and want the students to return to a clinical environment for their training as soon as possible. She added that they are hoping to get sufficient vaccines soon to include students who are on clinical training now, and that safety has been a guiding principle for decisions.
We want to be team players like everybody, but sometimes it's really like the experience at VCU. The team is defined according to the people that have the vaccine, and that's not right.
It's not just medical students at VCU who expressed concerns to CBS 6 about vaccine prioritization so far. Dr. Thomas Epps Jr. is a family physician outside of Lynchburg. He says primary care providers like him, who are not affiliated with a hospital system, have a harder time getting the vaccine.
I was rather insulted that a legal consultant for the hospital got his vaccine before I did.
Virginia's Secretary for Health and Human Resources was asked yesterday whether folks who telework yet work in industries that are in the second and third priority groups for the vaccine will be prioritized for vaccination, and he said no. Working for you, I'm Melissa Hippolyte for CBS 6.